Hi everyone, welcome back in today's video. So in this tutorial we shall be discussing common medical abbreviations. So before we begin our tutorial, I would like to define the meaning of medical abbreviations. So medical abbreviations is the shortened. Medical abbreviations is the shortened form of words or phrase that are used in the field of medicine, in the field of medical. So medical abbreviations is the shortened form of words or phrase that are used in the field of medical. So examples include, the first one we have is BOM. So the first word we have is BOM. So BOM means prescription only medicine. Prescription only medicine. Prescription only medicine. So BOM means prescription only medicine. So these are drugs, these are medicine that are prescribed by only qualified healthy medical officers. So you cannot take them without by the doctor's prescription. So this is what we call BOM. It means prescription only medicine. So these medicine are prescribed by a qualified medical officers only. So you cannot take them by yourself, or you cannot buy them in a chemist and use them by yourself. So they are only written and prescribed by a qualified medical officer. Okay, the second word we have is OTC. So the second word we have is OTC. The second word we have is OTC. So OTC means over the counter. OTC means over the counter. Over the counter. So over the counter, these are drugs that you can buy for yourself in a chemist, and you can use them by yourself without doctor's prescription. So OTC means over the counter drugs. So these are medicine whereby you can buy them from a chemistry and you can use them by yourself without the doctor's advice, without the doctor's prescription. So you can take them by yourself. Is what we call OTC, over the counter drugs. Okay, we also have O stroke E. We also have O stroke E. So O stroke E means on examination. O stroke E means on examination. So this means when a doctor is doing a physical examination, so he will shorten the words by writing O stroke E, which means on examination. Okay, the other word we have is R stroke O. So R stroke O means rule out. So rule out means is when the doctor sees a patient and he has written his note, then he will read the decision on what procedure he should do. So this is what we call R stroke O, which means rule out. Okay, so R stroke O means rule out. The second word we have is IU. So IU means international unit. So IU means international unit. So IU means international unit. So this means drugs are most of the time they have, so they come into forms of composition like the milligram, we have the gram, we have the microgram, we have the millimole. So international unit are drugs like those who have large doses. For example, we have the benzazyl penicillin, which is 5 mega unit, that is 5 million units, or 6.2 IU, that means 6 million unit. So IU means international unit. Some drugs have these milligrams. So this is what we call IU. Okay, let us move. We also have IM. So IM means intramuscular. So intramuscular is a type of injection whereby it is given deep into the muscle. So this is what we call IM. So IM means intramuscular. Okay, we also have IV. So IV is the shortened word of intravenous. So intravenous is a type of injection whereby it is given through the vein. So IV is the shortened word of intravenous, which means is a type of injection whereby it is given through the veins. Okay, we also have SC. So SC is the shortened word of subcutaneous. So subcutaneous is a type of injection whereby it is given in the subcutaneous tissue, deep into the tissue. So SC means subcutaneous, which means is a type of injection whereby it is given in the fatty tissue. Okay, we also have ID. So ID is the shortened word of intradermal. So which means is a type of injection whereby it is given below the skin. So ID is a type of injection whereby it is given and below the skin. Okay, we also have cap. So cap is the shortened word of capsule. So cap is the shortened word of a capsule. So drugs can either be tablet, it can either be capsule, it can either be syrup, or it can either be an IV, it can either be IM, it can either be topical, so like that. Okay, the other word we have is a tab. So tab is the shortened word of tablet. Okay, we also have VL. So VL means vial. So vial is a small bottle which is very hard to break, and it contains borderate medicine which can be reconstituted. So this is what we call a vial. Okay, the other word we have is amb. So amb means amble. So amble is the smallest container which contains a drug. So the doctor can easily break it by squeezing with the index finger and the thumb, so it can easily be broken.